Hey, before we get started here, I want to invite you to do something for me as I've been sharing these podcasts with you for the past number of years. If you've been listening for a while, or if you're a brand new listener and you like what you hear, I invite you to go to Apple or Spotify podcast and leave a review and a rating. This really helps us to grow the show and helps more people discover and learn and to listen to what we're sharing here on this program. So if you can do that for me, I work every week to bring this show to you. It takes hours and hours to produce a show like this, and I do it absolutely free to you. And so if you could do that for me, leave a review and a rating, I would really super appreciate it. Now let's get into the show. Welcome to the First Responder Wellness Podcast. My name is Conrad Weaver. I'm so glad you decided to join us today. I have a really special guest today, and I can't wait to share him with you. My guest today is Dr. Eugene Lipov. He is an anesthesiologist and a pioneer in the treatment of trauma through a procedure you've probably heard about called the Stellate Ganglion Block. It's sometimes known as the God shot. We talk about how this 5-minute procedure can reset the body's fight or flight system. And he shares a few powerful stories of transformation from his first responders and veterans who he's worked with and who have experienced this treatment. And toward the end of the show, we talk about why Dr. Lipov believes that PTSD should be renamed to PTSI, post-traumatic stress injury. Be sure to listen all the way through for that last part of the interview. I think you will be excited to hear what he's working on in this manner. This episode is all about hope and about healing trauma. Are you ready for your God shot? Let's dive in. Well, Dr. Eugene Lipov, it's great to have you on the First Responder Wellness Podcast.
Thanks for having me. I really appreciate it.
So we have some mutual connections that we want to dive. I'm going to dive right into it. In my documentary, PTSD 911, we have a subject. His name is Matty Fiorenza. He's a firefighter out of Anaheim. And as we were in production for the film, we were able to get him out to you. We didn't really cover this in the documentary, but tell us what you guys did.
That's a very broad question, my friend.
Tell us what you did with Matty.
If you don't mind, let's just go back for a second.
Sure.
Why we're even talking? I just want to kind of set the scene, as the commentarians would say, right?
Yes.
So I'm an anesthesiologist. I'm a pain doctor. So I'm definitely not a psychiatrist. And my particular interest is psychophysiology, meaning there's a biological condition that can be treated physiologically that most people think of psychiatric. Psychiatric condition is like, what is it? Is there? Does it really exist? Does PTSD really exist? Is it a weakness of the soul? Are you a wuss? Whatever. So if you look at it from that perspective, it's pretty hard to fix. Plus, it induces stigma because then people second guess themselves.
Yep.
That's not a good thing. And we can talk about the stigma a little bit later. But the bottom line is the way I see the word is PTSD. By the way, the name needs to be changed to PTSI, post-traumatic stress injury. We'll talk about that as well. But what happens is when there is significant trauma or multiple traumas, like bullying, for example, fight and flight nervous system in the brain changes and stays basically stuck on. So if you're about to get hit by a bus, you feel hypervigilant, you can't sleep, all of that. But that goes away. If it stays like that, then you have PTSD. Shocking. So turns out if you do an injection in the neck, which numbs out the nerves in the neck, it can reset the sympathetic system, a fight or flight system, to the pre-trauma state. So I was the first one to report on that in 2008, and I've been working on it since. I've treated a lot of special forces, first responders. In fact, I used to be a trauma surgeon, so I saw a lot of first responders get injured and all of that.
Mm-hmm. So we're talking about the Stellate Ganglion Block.
Right,
so
Stellate Ganglion Block, yeah.
Let's describe what is that? I mean, it sounds like painful to stick a needle in your neck. And so what is the Stella?
Well, first of all, not for me. Anyway, so the way it's done is, first of all, if people are concerned about needles, we can put people asleep. We can sedation. The procedure is about 5 minutes. So Well, let's talk about technically how it's done. So the patient comes in, they lie in a bed, we clean out the neck, we numb up the skin.
Mm-hmm.
It hurts less than dental shots because there's many more nerves in the mouth. Then I use ultrasound guidance to find out the target, where we have to go, and then put a needle next to the nerves there. We inject the medicine, 5 minutes, and then people get droopy eye, meaning in the right spot. And that's pretty much it. And a lot of times people have a response in about 10, 15, 20 minutes.
Mm-hmm.
So that's go ahead.
So what is that exactly? What are you putting into
what's
near
the
that
drug?
nerve? Yes.
Bupivacaine. Bupivacaine is a drug that's been used since 1972. For example, pregnant women get it during epidurals.
Mm-hmm.
So the drug has been around forever.
Mm-hmm.
It's not, most people just go, I don't understand that. So local anesthetic, you numb something up. It's not a psychiatrically active drug. It's not. It's a totally different mechanism. And that's why I've been on this journey, which has been a fascinating journey so far, which took me a lot of interesting places, to try to get people to think about it. Like when I was in the doctor's show, they said, shot in the neck, how does it do anything to the brain? I don't understand any of that. Because this is asked by physicians, ask me that all the time, because nobody thinks about that. I think about it a lot because I've seen it work and I publish on it all the time. So the key point is there is a direct connection from the neck to the brain, and you can do something with it by numbing it up in the neck. So you don't have to get inside the brain. That's why, it's counterintuitive. But the reason we build a whole practice around this concept is that it works 5-10 minutes, very rapidly. Compliance is very high, meaning if you lie down on the table, it's done. Thank you very much. You're great. Goodbye. As opposed to taking a medication that doesn't work and makes you sick. So that's why we've been really trying very hard to get people to start doing it. Just to give you a feel for that, SOF, Special Operative Force personnel, is about 10,000 of those guys who received it so far in military hospitals. So we're starting to get progress with that. It hasn't been as embraced in the civilian world, but, we've been trying pretty hard. So hopefully my appearance with you in my new book will help us move it along.
So going back to my original comment that, Matty Fiorenza came out to see you, and actually his wife as well, and they they both got the shot. And talk a little bit about that process. And obviously, Matty has told the story, but there was an amazing result from this experience.
Yes. Yeah, it's a cute story. Anyway, so the basic process is patients need to be evaluated. It's a medical procedure. There's no question it's a medical procedure. It's not waving hands. So we make sure people are healthy enough, the heart, lung, all of that. And psychiatrically, patients are the right candidates for us, which is pretty standard. We use standard assessments called PCL, PTSD checklist. Anyway, so the cool thing about that particular story, the reason it really stands out in my mind. So 2 years after the procedure, he did well. He said, I can sleep, doc, think of the usual. So it improves like sleep function. It improves reactivity. It improves mood. And people are not as spunky. So one of the terms that people really think about, in my opinion, is called secondary PTSD, meaning the guys have PTSD, typically, and they give it to the women. My father had PTSD from World War II, and he gave it to my mother, who took her life. So I'm very interested in that particular aspect of it. So you can think of PTSD as infected agents, like a cold. So because we have a number of women say, I cannot have PTSD. I've never been to war. I've never been assaulted. I've never done this. It's like, so is your husband cranky a lot? Yes, it could be I have to close all the drapes to make sure I don't trigger him. Well, you do it for years. It's not good for your brain either. Anyway, so I get a phone call from Manny 2 years later. He said, Doc, I have great news. I said, you feel good? Yeah, I feel great. Thank you. But we conceived the day after the procedure. I said, well, I had nothing to do with it. That's all good.
Be clear on that.
Yeah, I just want to get it on the record. No question. But what they said, that his wife and him have been trying to have a baby for 15 years. And then, poof, right after the procedure, they conceived literally the next day. And guess what the name of the child was? I think I told you before we started.
Yes, you did. Yep.
Jordan, for Michael Jordan. I thought that was the funniest thing.
Because it was in Chicago where this took place.
Chicago, exactly. So because I would ask that question from my staff, and I said, what do you think they called the child? Stella, because the name of the company is Stella.
Right.
Nah, Jordan. I thought it was brilliant. But then if you can break down the reason that happened is interesting. So to me, it's all about physiology, right? So there was a paper written in Italy where they did stellate ganglion blocks for infertile women. Half of them got pregnant. So there are two reasons I think the pregnancy is delayed or very hard to do in people with PTSD. One is the lining of the uterus cannot get thick enough for implantation. And that's because the fight and flight system is too active in the brain and the uterus can't get pregnant. The other part is, for example, 85% of men have sexual dysfunction with PTSD. You can reverse it with a stellate, which is really interesting. I wrote the chapter, and anybody who's interested in the sciencey part of it, you can go to my website, dr.eugenelipov.com. I wrote the chapter on exactly why I have it. But what's cool here is that they were relaxed, they were calm, all their equipment was working appropriately, and the timing of it, that's the first time I've ever heard that. That is so cute. And the kid is this cute blonde child. She's so cute.
Yeah, she is.
It was just, I love that story. It's so happy, right?
Yeah, absolutely. How long, or do you need to have multiple shots in order to, how long did the effect last? I guess is my question.
Depends on three things. Number one, genetics. Because, for example, like my grandfather was in a lot of problems in Ukraine. He gave so genetics, it's called epigenetic transmission, goes 2 generations. So he gave it to my father. My father went through the war. He gave it to me. So my chance of getting PTSD was high. So it depends on genetics, number one. Number two, depends what you do after the procedure. So after the procedure, a lot of people are very open to successful psychiatric intervention. It's like talk therapy. And we're able to get people off the drugs a lot. And also depends, number three, what happens. Like we took care of a CPD, Chicago Police Department guy. He was doing great for a year. Then he had to shoot somebody in the line of duty. A year later, he had to come back. So it seems to last 6 months to a couple of years in the beginning. And then some people need more. I've had one guy in Portland. He was doing great, 8 years. He has whatever. He said, I need to come back. And people say, when do I need to come back? So my answer to them is usually, the person who's going to know most if you have a significant other, ask them. If you're becoming difficult and prickly, it's time to come back.
Yeah. So it's not this magic cure-all that, you do this and all your problems go away. You have to still do the work, right? But I kind of see it as, I kind of see it as clearing up the mind in order for you to be able to do the work.
Well, let me give you a real example. And this is very relevant to your show. So we have an office in Australia. So there was a gentleman there. His job was, per his description, not my description, picking up and dragging dead body out of tunnels in Sydney. Lovely job. So he was suicidal for 10 years. His wife told him she was not particularly nice to him, shall we say. Anyway, so the psychiatrist took care of him, gave him psychiatric medication. He did 5 years of psychotherapy, nothing, no progress. He has one stellate ganglion block. In 2 weeks, they made more progress than in 5 years.
Wow.
That's my point. Did it take away everything he's seen?
Sure.
No. But I'll give you one more example, and I think it'll get you a feel what it feels like. So the second person I treated, the first guy was a victim of crime. The second one was special forces for, he was in somewhere in Illinois. And then his name is Jason Brown. We have some YouTubes with him. But anyway, so he was leading a squad in Baghdad. 10-year-old kid was sent to take them out in an explosive belt. So Jason shot him. Piece of that kid hit Jason and his squad. It was a complete mess. He came home completely destroyed. He tried to strangle his wife 3 times. So severe, right? So we do one procedure, and we still have the video of that. About 10 minutes later, he says, I remember shooting the kid, but I remember black and white, not all this vivid gore. Because there are 2 memories. There is amygdala, which controls emotional memory. There's hippocampus, regular memory. This deactivates the amygdala. So he can process it now. It's in black and white. It's not as bothersome. Not interesting. And so you can split it, and then just the injection in the neck. It's not a pill. In order to do that effect, if you take a pill, how does a pill know to go to that spot of the brain? It doesn't. Right. It can have a lot of other side effects. Here, it's very specific. That's a part I love about it.
Yeah, very cool. So why do you call it the God shot?
Another great story. So, you're old with your stories for everything. So I happen to be true, which is extra bonus points. Anyway, so we were taking care of a squad whatever. There was a group of Marines that I was taking care of. So one of them said, some of the guys in my troop call it the God shot. I said, why? I said, because it changed their lives. Who could change your life but God, right?
Right. Hey, for the past several months, I've been enjoying using the Train Well program for my daily workouts. I used to be really inconsistent with working out, and often I didn't know what to do next to achieve the results I wanted. I felt stuck. Train Well has solved that problem for me. So if you would like your own personal trainer to guide you, it's actually really easy. Visit go.trainwell.net/first responder wellness. That's go.trainwell.net/first responder wellness and start your journey to a better you. If I can do it, I know you can too. Hey, the link is below in the show notes. So is this shot widely available? Are there just specific clinics that do this?
So, yes and no. So, Stellate has been done, as I said, since 1926. Most clinics will not do it for outside standard indication, which is hand problems and headaches. I am a CMO of Stella Center. So we have 24 sites. In the United States, we have 1 in Israel, and we have 3 or 4 in Australia. So it's getting more available. Other people are doing it. Some people who are doing it should not be doing it. Like I had to there was a gentleman, and I use the term very loosely. He's not an MD, he's not, whatever. And he was doing them blind, like without ultrasound guidance. He's not trained in it. If there's a problem, he can deal with it. That's dangerous. So I report him to the state, actually. This is no joke. It's a safe procedure, but it needs to be people who are trained.
Sure.
Plus, and over the time, I figured out 2-level injection is much more effective than single-level injection, which has never been done. I can tell you that story, how I came about it, if you like.
Sure. What is a 2-level injection?
We call it DSR. That's what we do here, dual sympathetic reset. So the standard technique is C6 injection, 1 level. So I had a patient who was a sniper, Marine sniper, and this was years ago. And then I treated him. He comes back a year later. He said, no, my back's fine. I'm just going to kill myself today. I was like, whoa. His wife is with him, right? And they everybody's crying. There's like, I said, well, let's put you in the hospital. No. Let's put you in the VA. No, absolutely not. If I go there, I'm going to die. I was like, you're putting me in a bad position. He said, well, tough shit. It's about me, not you, doc. I was like, whatever. Anyway, take him to the operating room the next day. He talks me into it, whichever way. And I do the block and nothing. He's still 40 minutes later. He's looking. I'm still going to go home, kill myself. I was like, oh my God, that talk about scary.
Sure.
I had to go change my outfit. And then, so before I got into the PTSD, I was doing cow flesh injections. So government of Norway invited me to lecture to them years before. I learned something called C3 block, which is higher up. So there are a couple of different sites you can actually inject. So I take the guy back 40 minutes later. I do the injection, higher up. Comes out 5 minutes later, gives me a high five, said, I'm fine.
Wow.
We followed him 5 years, no problem. Didn't die, he survived. I was like, whew.
Wow, yeah.
Then I go, it's like, okay, so why would that happen? Because, there's going to be 5,000 people telling me I'm an idiot, which I already experienced that before. So I'm trying to understand why would that work? First of all, why would it work? And second of all, why didn't anybody else do it? So I found a book by James Moore, Stellate Ganglion Block, 1954, out of print in 72. I got the last one from Amazon. So there's a nice little diagram that shows what happens. Fight and flight nerves go from the chest to the neck, up to the brain, through one artery. Other half goes C3 to a different part of the brain. So when you do 2-level, it resets it better. So the effect is stronger and longer lasting. And that's why we do dual block.
Well, this is amazing stuff, amazing technology, amazing medicine. And what you're doing is, you're saving lives, and which is so important.
It's an honor. Well, it's not, there's two, the other part of the reason I'm really excited about it, saving lives is great. Believe me, one life is a lot. We've saved at least over 100 for sure. But the other part is, for every life that's saved or not saved, think of the misery. Like I took care of a gentleman from Puerto Rico, and this is the cutest story to me. And it's like, I don't know why, but I just love those stories. Anyway, so every time we do the block, he needed so far, I think, 3 or 4 injections. He says his wife told me this. Temperature in the house goes down. Right? So it's calm, collected. Daddy is not pissed off. He's not bouncy. But I'll tell you, it's the cutest thing. So when the last time he came back, he had a little video message from me from his daughter, 5-year-old kid. Dr. Lipov, thank you so much for giving my daddy back. I was like, oh my God, that's the funniest thing in the world. And she is the cutest little thing. I thought that is really fun. I mean, but my point is, I've lived in that environment when somebody has PTSD. It's a tough environment to be in for a child. You're trying to interact with adults, but adults not doing it, and they're cranky. It's nobody's fault. It just happens. It doesn't matter why it happens. People blame themselves, like, I should be nicer, blah, 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 blah. You can't help it. It's just like saying, okay, I can walk uphill with a broken leg. Fix the leg, and then you can walk uphill. But now, if you think about what we're currently doing, the leg is broken. We're saying it's not broken. Keep running up and down the hill. Well, that's freaking stupid. In my opinion.
Yeah. What would you say to those first responders who are listening, who are like, I'm not sure if I should do this? What would you say to them?
Well, like I said in the beginning, if you want the same results, keep doing the same thing. If you like having difficulty sleeping, being cranky, having sexual issues, drinking too much alcohol, wife, typically, not always men, but a lot of times, telling you need to get help. I mean, if those are things that you're comfortable continuing where you're at, keep doing what you're doing. If you want to change that, I think you should consider doing. But the first thing I think you think about it, I think not just first responders, everybody. There's hope. Nobody commits suicide with hope. There's hope that it's a biological, it's a real condition that is treatable. I'm not saying stellate is the only way to go. I'm saying it's one of main ways to go that works rapidly, right? I'm not a patient individual. I don't like waiting for years for results. I'm also a fan of ketamine for certain conditions, like especially depression. But the sleep dysfunction, so two things predict suicidal ideation and activity: impulsivity and sleep dysfunction. You may notice I have an Oura ring, so you can see how well you're sleeping. So, I mean, it's like you can take charge of your own health. Like, for example, first responders, 100 Club of Illinois is willing to help us pay for those procedures. But it can change lives, right? I mean, it's called a gut shot. I mean, it's a little too full, too whatever, but it's truly changes lives. I've seen life change and transform. And people, after you get some sleep, like I've had people that have not slept well for 25 years. We do the block. The other thing is, if you're still an active duty policeman, let's say, think about target differentiation. So think of, like I've treated a lot of snipers. If you're a frenetic, if you're looking everywhere, you're not a good sniper. If you can get laser, that's what it does. Laser focus is where you want to be. So if you're walking down the street as a policeman, let's say, and you see somebody in the corner eye, that microsecond decision can make all the difference for both sides, person being shot and the shooter, right? So it's like, if this is a civilian, you probably, that's really not doing anything wrong, you probably don't want to shoot them. Your target differentiation is off when you have PTSD, right? Nobody's really talking about that, right? If you haven't slept, you're like, what's going on with me? It's not, you can sleep 10 hours. If you're not sleeping in deep sleep, the stuff that actually, it's an interesting concept that recently came up. It's called glymph. It's a glymphatic system where when you're thinking, you're producing byproducts of thinking. The only way it comes out of your brain is if you're in deep sleep. If you're superficial sleep, like light sleep, it's still there. So you get up in the morning, you're like, you're groggy. So you have to take some kind of a stimulant or drink a bunch of coffee, all of that. That does not make you an effective policeman, fireman, husband, whatever. You need to be calm, chill. When you need to get going, like I've treated active duty not active duty personnel who really felt that they were much better in the field. And it's about typically, those guys and police, it's about the mission, right? It's about the mission.
Yeah.
If you can do the mission and come home and be a reasonable human being to people that love you, I mean, I hate misery of mental health. I've lived through it. I do not recommend it. It's painful.
Yeah. So how can people learn more about Stella and how can they learn more about you?
Well, I'll give you a few things. So if you want to have a procedure done, if you look up stellamentalhealth.com, it's just one number, and then you can find something close to it. As far as me, I have my website is dr.eugenelipov.com. So if you want any sciencey publications, anything I published, if you want to dig into it, everything is there. If you want to read about, the book, pre-order the book, if you like. It's thegutshotbook.com is the website for that. And if you can do the survey, which potentially can save tons of lives later, it's PTSI.com.
Okay.
And short of that, I think you'll know more about me than me.
And I'll put all these links in the show notes so people can access that directly. And I'll be sure to push out this survey. So going back to what you mentioned about PTSI, there is a movement, and I've talked to some other people about this who are behind this movement as well, to reassign the designation PTSD, the disorder, to an injury. Why is that important to you?
Well, let me tell you where it started. I didn't come up with this name. I'm not that smart. So the person came up with the term. His name is Frank Hugbert. He's currently 87 years old.
I've spoken to him.
You talked to Frank?
Yes.
Oh, there you go. Mm-hmm. Amazing, man.
Yeah.
So he came up with the term Stockholm Syndrome. So, he's like really like heavy duty guy. So he was one of, I think, 8 people in 1980 who came up with the term PTSD. Through his experience, what he found, science moves along, shocking. So biologically, you can see PTSD on brain scans. Mm-hmm. So if somebody says, I have an invisible injury, my point to them, you have the wrong scanner. Get the right scanner, you'll be able to see it. Mm-hmm. Right? So that's one. That's the reality. Because there is a biological component to PTSD. There's no question about it. You can see it. And then I did a study in 2023 that shows pretty convincingly that if you change the name PTSD to PTSI, post-traumatic stress injury, the stigma will get better or go away. Mm-hmm. If you get rid of the stigma, number one, people are not going to kill themselves, which is kind of nice. Mm-hmm. Number two, they're going to seek care, so they're more likely to survive and get out of this. So the reason the name needs to be changed is because get rid of the stigma and save the people. So in 2013, Frank and Pete Shirelli, a 4-star general who was in charge of suicide prevention with the Army, went to American Psychiatric Station and said, our guys are killing themselves. Can we please change the name because they feel stigmatized? And APA told them, no, thank you, goodbye. So since then, I did the study. And then I sent my study, which is a survey, and as well as in order to change the name formally, you need to submit a bunch of forms, you can imagine. Mm-hmm. And there's one specific reason to change the name. If it shows that it causes harm, they will change the name. That's what it says on the website. Mm-hmm. I sent them all that, and I said, it's causing the harm. I can show you at least 500 people, SOF, they'll tell you that's true. Mm-hmm. Here's my study. And keep in mind, DSM, which is a committee who is in charge of name change, recently changed the name Learning Disability to Learning Differences. Get rid of the stigma. I'm totally fine with that, of course. However, there's many more people with PTSD than learning disability or whatever.
Sure. Yeah.
They changed that name, but for me, they said not enough information. However, I'm one of those, my brother calls me BB, Brother Bulldog. So I'm a persistent individual. So here's what you can do for all of us, if you don't mind. So I have a website, itsptsi.com. So it's PTSI. Very simple, right? Mm-hmm. So there is a survey there, a formal survey we got through all the credentialing stuff. So, excuse me. If we can get as many people to fill it out, I'm shooting for 100,000 people. Fill out the survey. If you can help me promote it as much as you can, that could save lives, literally.
Absolutely.
I saw a stat yesterday. Every 11 minutes, there is a suicide in the United States.
Wow.
I think about what that means. People go, oh my God, there's 24 soldiers killing themselves in the United States. Mm-hmm. If you look at that statistics, that's a CDC statistic, it's 130 people per day kill themselves. This is currently the highest suicide rate. The last time it was this high was right before World War II. That's the highest suicide rate of teenagers and preteens. Mm-hmm. We have to be doing something different. Whatever you're doing, we're on the wrong path.
Right. Because if you keep doing the same thing, that's the definition of insanity, right?
Einstein was a smart guy, yeah. Yeah. But my modification of that statement is, if you want the same results, keep doing the same thing.
Mm-hmm. Yeah.
That's what we're doing. But in the Army, they say only harder. Do the same thing, only harder. So you fail even harder.
So you're going to fail harder. You're going to have more bad results harder.
That's what we're doing.
Well, Dr. Lipov, thank you so much for your time, for your work, and I really appreciate that, and appreciate you spending time with me today on the podcast.
Thank you so much.
That was a fun interview, and I hope you enjoyed listening as much as I enjoyed talking with Dr. Lipov. Be sure to check out all the links below in the show notes, especially take that survey. Let's get PTSD changed to PTSI, and your survey responses help that effort. Hey, if this episode resonated with you, share it with a teammate and leave us a review. We'd really appreciate that. And don't forget that your health matters, your performance matters, and most of all, you matter. And like I've said many times before, wellness is not optional. In fact, it's essential. And finally, please remember that you are not alone. And if you need someone to talk to and don't know where you can turn, you can dial 988 for help. Until next time, be well, take care of yourself and those around you, and go out and do something great in the world.